have been coming a couple weeks now, you have a whole bunch of muscles that you've learned how to test, and we've watched you do it, and you can do it really well. So right now, you guys have this little component of AK, which is the muscle testing. But my guess is that everybody's pretty lost about what to do with it or what the purpose of it is. So you kind of have to understand the framework in that all of these AK protocols are applied in order to use them. And I know you've also seen some of us demonstrating a lot of the protocols, but it's still sort of like, when you get a patient, what do you do with them? Like, where do you start? You know, you're a little bit lost. So if you can put everything into a little bit of a framework, you'll start to get a flow in determining how you want to apply these protocols. So if you go all the way back to the beginning, this is about treating patients and figuring out what a patient needs on a given day at a given time. So your patient's going to come into your office, and generally you're going to have one or two scenarios. Either they're going to have a history of trauma, something specific like I fell down the stairs or I sprained my ankle while I was jogging or something like that. And then there's a whole realm of protocols that you can go to over there. And we're going to do that another day. So if you're taking notes, keep that space open because we'll talk about those eventually. But right now we want to talk about the basis of applied kinesiology, and that is the 5 factors. So generally a patient's going to come in and they're just going to sort of be like, here's how I feel, here's what's bothering me, and there's not really a specific action that caused trauma. They're going to fall into these categories where you have to figure out which body system is the one that needs support, treatment, therapies, adjustments, etc. And there are 5 of those body systems that we work in. The first one, most obvious to chiropractors, is the spinal nerve root. And generally this is adjusting specifically for misalignments or nerve interference or something along that realm. You've also heard us talk about neurolymphatic points. These are certain points that relate to certain organ dysfunctions. You might use them for a variety of other systems, but generally you can apply therapy to these points to support different systems depending on what you find. There is also a component of Chinese medicine, acupuncture, and meridian therapies. It's pretty much AK concepts as applied to Chinese medicine. They kind of fuse those topics together. There are neurovascular points that relate to blood flow or dysfunction of blood flow to organs or regions of the body. And then there's the concept of the cranial sacral respiration mechanism and whether or not you have proper flow of CSF due to the movement of your bones and the movement of the CSF with respiration. So looking at that, you're kind of like, oh my God, that's a lot of systems. What do I do? And now you get to tie in everything that you've already learned. You have all of these muscles. Those are windows into these different systems. They might be indicator muscles like we talked about. They might be not related at all, but you can use it to determine where you need to apply treatment or therapy. Or muscles might be specifically related to certain systems in the body, and you can use those as a window to figure out which systems are functioning properly or improperly. And then this is what we really want to get into today, is therapy localization. So you've all heard that word. We've talked about TL before, but now we need to sort of make you understand it to the point that you can actually use it to figure out which direction you're going over here and how to apply that therapy. So that's where we're going to go today. Any questions about the flowchart part? Does that help to kind of give you a window into where we're trying to get you? Cool. All right, let's get into TL. You want to teach TL? No? Do you want to teach TL? Okay. So therapy localization is a concept of asking the body where it needs treatment. So in the most basic format, you're going to have a muscle, an indicator muscle. It's not related to anything. It's just a muscle that you found on your patient that's facilitated, that's working and responding properly. TL means applying touch to an area of the body that you suspect might need some kind of intervention, and retesting your indicator muscle to see if you get a neurological change. So if it was a facilitated muscle and you touch the TL area and therapy in that area is indicated, the muscle would inhibit. Does that make sense? So you're getting a change in the tone of the muscle. That would be a positive finding that, yes, you need to apply some sort of therapy to that area. If you have a facilitated muscle, you TL an area that you're questioning involvement, and your muscle stays facilitated when you retest. It's probably not an area you need to look any further into. Another thing to consider is that TL can be done by the doctor or the patient. Traditionally, for most of the protocols that we're going to teach for AK kind of in the beginning, it's patient TL, so you're going to have your patient touching an area of their spine or one of their neurolymphatic points as you apply your muscle test. So, questions about that?
Are you touching the origin or where the...
It depends on what you're looking for over here. So you might be touching a specific vertebra. You might be touching the origin of a muscle. You might be touching a neurolymphatic point or a neurovascular point. You might just take a hand and put it over the entire neck to see, is the neck involved? And say you did that and your muscle inhibited and you have a positive, yes, the neck is involved in this scenario, then you might touch C7 and C6 and C5 to figure out which specific vertebra it is. So that's kind of a basic application, and that's the kind of stuff that I think maybe we'll do today to just practice.
Would you have them like touch individual, or would you?
You have them do it usually, but I would take their hand and place it exactly where you want it because they tend to just sort of put it wherever. You also generally want to use the pads of your fingers and not your thumb. There's a couple different theories as to how TL works, and one of them involves kind of the polarization and, I guess, electric exchange of touch, and your thumbs are polarized differently than the pads of your fingers, so we generally don't use thumbs. And there are some things where you use the back of the hands, but generally it's the palm of your hand.
Do you want to talk about using therapy mobilization with an inhibited muscle also in terms of just
That's a good question. You can use TL when you have an inhibited muscle because, again, for a positive response, you're looking for a neurologic change. So if you're starting with an inhibited muscle and you TL something, in order for the muscle, or in order to get a positive response, then you would have a facilitated muscle at the end. So as long as the muscle changes, but most often you're looking for, as you start out, you're usually starting out with a facilitated muscle, but some of these things require layering. You know, you ask one question, you test the muscle, you ask another question, you test the muscle, you kind of keep going. So you might start with a facilitated muscle, TL, and have it inhibit, alter your test a little bit, have it facilitate, and you might be going back and forth as you progress through the layers of what you're trying to diagnose, essentially. I don't know if that got confusing. Any other questions? Okay, let's practice some TL then.